we've talked about a number of things, and what I want to finish up with are not only some of the current things we're doing with vitamin C, but also some of the important applications where vitamin C and other modalities are integrated together, and oftentimes we get not just an additive response, but a synergistic response, okay? Maybe about a year ago, Dr. Huntinghacky of the Reardon Clinic and I knocked our heads together a little bit, and we both knew that, of course, what vitamin C can do by itself and with things like antibiotics. And there's also, although we haven't talked about it much, an incredible body of evidence on what ozone does. Ozone is what I call affectionately the magic gas. It literally seems to do everything you want it to do, and it doesn't do anything that you don't want it to do, so that's pretty good. What is this? Now, so the concept of ascorbazone, ascorbate, ozone, ascorbazone, is that both have powerful pro-oxidant capacity, so the ability to metabolize and oxidize and destroy pathogens. And of course, the one thing that the vitamin C has that the ozone doesn't have is tremendous ability, of course, as we mentioned before, to support and strengthen normal immune function. And let me say at this point in time, in case it's not completely apparent from what we were talking about earlier, because of the fact that health and disease all pretty much relies on where your redox or reduction oxidation balance is in your body and in different tissues, in absolutely every sense of the word, you can view vitamin C as being the primary fuel that your body runs on. It's literally gasoline for your tank. And when you're low on it, you don't run well. And when you're high on it, you start to repair damage and you do well. It's all about electrons, or at least what we understand electrons to be, since, to the best of my knowledge, nobody's ever seen one. Now, when or why would we use a therapy that combines the modalities of ascorbate, vitamin C, and ozone? Basically, you want to reserve it for the toughest cases and the cases that haven't responded to a simpler regimen. And we'll see in a moment, a lot of those tougher cases have to do with some of the chronic, more refractory infections that we talked about earlier. Okay, certainly there's no need to do ascorbazone when somebody is getting a cold or the flu or the measles or the mumps or something like that. Just feed them well, give them vitamin C and any of a number of methods, and they'll do great. Now, what conceptually are we trying to do with ascorbazone, which is a good idea to let us know exactly what our goal is? Not only are you looking to achieve as close as possible a vitamin C saturation in the tissues, you're also, and this is just as important, you're seeking to not only reach that saturation, but maintain it as best you can. You just don't want to spike into the saturation and drop back down quickly. You want to get it up there and keep it up there. And at the point in time that you saturate and maintain, you start getting incredible tissue repair and incredible anti-pathogen properties. Now, with regard to the ozone, ozone's a little bit different. And the thing about ozone is it's very, very potent against infections, but it's also completely unlike vitamin C. It's absolutely critical that you follow the rules with ozone. You know, don't go going crazy and thinking that if 5 cc's of this concentration is good, 10 cc's of 2 or 3 times the concentration is better. Not at all. The treatment regimens on ozone have been worked out over the last 150 to 200 years. They've absolutely stood the test of time. And when you start violating them, you don't always get a better result. And you can start running into some of the rare but real toxic and downside problems to ozone. And like I say, that's in contrast to the vitamin C, because you can go crazy with vitamin C. You just give whatever the heck you want, as much as you want, as often as you want, and go with a high dose, go with a low dose, have a blast. Not the case with ozone. Follow the recommended protocols and don't think that if a little is good, more is better. Or if slow is good, rapid is better. Not the case. Now, when you use vitamin C by itself as a monotherapy, ascorbic monotherapy, what are you getting for that? Well, as we've talked about at some length, you are able to both neutralize all toxins, and just as importantly, you're able to reverse the toxic impact, oxidation, that's been inflicted on the tissue. So, in every sense of the word, vitamin C is the ultimate antitoxin. Because of this, you help to normalize the redox balance inside and outside of cells. You're also able to help tissues heal or reconstruct. As we mentioned, it strengthens the immune system in at least 20 different ways. Serves to resolve viral and bacterial infection. And also because of its critical interaction with glutathione inside the cells. Now, briefly about glutathione. Glutathione is your most concentrated and most important intracellular antioxidant. It's the most important antioxidant inside the cells. Vitamin C is your most important antioxidant everywhere else. But because of this and the fact that the only thing that gets a spent or used up or oxidized antioxidant back into functioning shape is an unspent antioxidant to regenerate it, that's how vitamin C, via the mechanism of supporting glutathione metabolism inside your cell, promotes the excretion of accumulated toxins inside your cells. Okay? Glutathione and glutathione-related enzymes are absolutely critical in you supporting normal and needed detoxification inside your cells. And the only way that glutathione stays active and vital is by having a continued influx of new vitamin C to regenerate the glutathione into its active forms. And logically, lots of vitamin C also helps you protect you against new toxic and infectious challenges. Now, ozone. Ozone as a monotherapy, used by itself. Actually, incredible antipathogen. It kills or destroys or inactivates viruses, bacteria, fungi. It literally breaks down and destroys the cell membranes. And in this capacity, it's more potent than vitamin C. Okay, so in terms of absolutely knocking out a pathogen, if you can surround or suffuse that pathogen with adequately dosed ozone, you're going to get an even quicker result in resolving that infection than with vitamin C. The extra thing that vitamin C brings to the table here, though, is since vitamin C is the essential fuel that your cells run on, once you've killed the pathogen, vitamin C is much more able to support normal cell function than something like ozone. So ozone is the ultimate leading killer, but you still need the vitamin C to help reconstruct and get your cells back into a normal, healthy posture. Now we have biofilms. I call biofilms pathogen condominiums. And the condominiums have strong walls, and you can have the most potent artillery imaginable, and you're not going to kill the inhabitants until you break down the walls. And that's what ozone does really well, and vitamin C not that great, okay? Ozone is excellent at tearing up and dissolving and destroying biofilms, which is another reason why vitamin C and ozone work so well together. The ozone is there to knock down the defense mechanisms, the biofilms of the pathogens, and then both ozone and vitamin C are available to clean up the damage after that. So probably, even though vitamin C hasn't been around nearly as long as ozone, we do understand what goes on with vitamin C a whole lot better than we know what goes on with ozone. But like we mentioned earlier, as long as you have a long-standing body of evidence present to demonstrate that something is just as effective as it is safe, there's absolutely no reason to avoid using it until you feel you have a definitive understanding. So, ozone is very reactive. The moment the gas gets into the blood, they form what's known as peroxides. They interact with lipids and amino acids. And this reacted ozone with these substances is called ozonides. There are many different variations. Now, the interesting thing about the ozonides is they're not, quite conveniently I might add, they're not immediately reactive with just cells and other tissues, but when they encounter a pathogen, they become extremely reactive. So that's why I say ozone is magic gas. It just does what you want it to do, and it doesn't do what you don't want it to do. How convenient is that? Now, obviously, I've talked earlier about the importance of not only infections, but oral infections, and being the most profound and most consistent and worst consistent provocateur of every significant disease that you get, in particular cancer and heart disease. Well, isn't it wonderful to have something like ozone to help deal with the primary pathogen challenges that present in the typical oral cavity? It's important to understand that even when you don't have a clinical infectious disease throughout your body, an acute flu or a bacterial infection, you still virtually always have the pathogens laying in wait, waiting for the optimal circumstances to suddenly start flourishing. And so you have infections and you have colonizations. And then you have the state of what I call normalcy, which is virtually no pathogens and the rest normal flora. But many people hover into that middle zone of colonization where they don't grossly have an infection or a cold or a flu, but they're just one immune challenge away from having it. You know, we do a lot of traveling, and I think lots of times you might get next to someone on the airplane and they're not coughing, they're not hacking, they're not sneezing, but they got this weird fruity breath that just seems to suffuse all your surrounding air. And they're not sitting, they're not coughing, and you're inhaling, and you're wondering what this strange smell is. Well, that smell is colonization. That smell is pathogens that haven't reached a critical mass, but they might in you. So one thing that they do with ozone that's extremely useful is called nasal insufflation therapy. Now, first let me say the one big no-no with ozone is not to inhale it. I mean, you'll know very quickly, you'll start coughing your brains out. Ozone directly inhaled is the absolute ultimate contraindication for ozone. However, when you bubble ozone through something like olive oil, it makes these ozonides that I just talked about, which are not immediately toxic to anything until they get down into your respiratory system and start to dissolve in the water interfaces, and then they become highly active against pathogens that are present. So doing stuff like just inhaling ozone of a right concentration through olive oil, I tell you what, if you have access to it, obviously you don't have access to it, this is academic, but if you have access to it, being able to inhale for 25 to 30 minutes ozonated olive oil, you'd just be amazed how quick you could knock out an early cold or the sensation that you're coming down with one, because it's always preceded by pathogen multiplication in the upper airways and the nasal mucosa and nasopharyngeal mucosa in the oral cavity. We mentioned earlier about tonsils, the fact that they could get chronically infected and they can still appear completely normal, but they could be absolutely undermining your health as bad or worse than any other focal infection. Due oftentimes, most commonly, to the fact that you had a chronically infected tooth, either a CAP tooth or a root canal treated tooth. For several months to a year or more, you could pretty much rely on the tonsil on that side being trashed, being chronically infected, and no longer giving you immune support, but instead offering you just the opposite, which would be an immune challenge. The data, of course, you recall that I said Dr. Joseph Issel's found in his advanced metastatic cancer patients that had been treated with every chemotherapy imaginable and had their bank accounts drained, and well, that's the ones that finally ended up with Dr. Issel's. And in this group, he found 98% had multiple root canal and other infected teeth. Now, I mentioned the tonsillectomy, and like I said, that's the worst experience I've ever had, so I don't go crazy trying to tell people to go get their tonsils taken out, but it's very important if you have a persistently elevated C-reactive protein greater than 3, and definitely if it's greater than 4, you are just a setup for any of a number of severe chronic disease, and especially a heart attack, and especially cancer. So, on the other hand, if you have a good solidly normal CRP, less than 1.5, preferably less than 1, statistically you'll fall into a very good long-term status for your health as long as the CRP stays in that range. You always have to periodically evaluate things. Things change. They don't stay the same. And if you're diligent, you can identify potentially horrible events in your life before the fact rather than after the fact. But you can't stick your head in the sand and just pretend that because you feel good today, there's no point in doing another routine check to make sure something bad is not on the horizon. Because at any point in time where you feel perfect, if you have a heart attack in your future, it's not going to just come out of nowhere. It will be predated, even while you're feeling well, with abnormal blood work, with abnormal CRP, with abnormal glucose, abnormal cholesterol and triglycerides, all of these things. These are called the metabolic syndrome-related blood tests. And I doubt there's been 5 people on the planet that have had a heart attack with solidly normal metabolic syndrome blood work and a CRP of 0.3. Just doesn't happen. So you have ways to, and when you identify things early on, it's a whole lot easier to bring them in check than to wait until they're full blown. Now, one thing I didn't know about when I had my event back in 5 years ago, where my CRP was elevated, and I was just assuming that my tonsils were infected, and it was a good assumption because they were. It's always a judgment call as to whether or not you want to do something gradually when you're already developing chest pain. Things could be at an emergent nature. You might need an angioplasty or a bypass. You might stay stable, and something like this will have a chance to resolve it. You don't know. So you have to be careful about recommending interventions that slowly resolve something when somebody has already presented to you with an acute clinical situation. So for whatever we think of mainstream medicine, let me tell you, angioplasty and bypass have saved a lot of people. Okay, and so when you're already advanced and you don't know if you're going to stay stable, don't take somebody else's life in your hands and tell them to avoid an angioplasty or a bypass at all costs. That's just simply not wise advice. As it turns out now, you can use these incredibly tiny gauge needles, 30 gauge. It's like it's like injecting somebody with half a hair. And when you take 2 or 3 cc's of ozone of 6 to 20 gamma, you can actually slip it directly into the tonsil. Doesn't even need to be the dentist that does it. We know where the tonsils are. You go right in there, inject 2 or 3 cc's, both tonsils, and they actually have some good series that show, I don't know if we can say the tonsils go back to normal, but they stabilize, and the effect that they're having on inflammatory blood work like CRP can come down. So if you have somebody with a CRP of 4, they've had root canals in the past, they're out, and you have a strong suspicion that it's the tonsils that are causing the ongoing stimulation of systemic body-wide inflammation, which is the worst thing you can have for your long-term outlook, go through a sequence of tonsil injections, and a lot of times you're going to see the CRP come into the normal range. And when it does, you'll have a very strong, indirect, but still strong confirmation that you've done a major positive intervention for your patient's health, or even for your health for that matter, depending on who it is. Okay. So when we combine vitamin C and ozone therapies together, we do get a synergistic effect, not just an additive effect, because the other thing you have to remember, and this is what ozone can never do, is the act of an infection is always associated with a rapid depletion or oxidation of your vitamin C and antioxidant stores. So, and this is one of the main reasons, still basically unrecognized, why some people with advanced infections do so poorly, is because you might be killing pathogens, but you're not supporting and replenishing the state of acute scurvy that has been induced by the infection. And that's exactly what it is. It's a state of acute induced scurvy. And when you have this acute state of profound vitamin C depletion, you don't heal, you don't reconstruct tissue, and you have lots of side effects. You have hemodynamic instability. So in a very healthy person, you could knock out an infection with ozone and not do anything else. In a profoundly depleted person, like somebody with Ebola, you might knock out the infection with ozone, but if you don't give them the support of nutrition or a lot of vitamin C, you might not get the long-term response you're looking for. So when is a good time to use ascorbazone if all the modalities are available to you? Well, the thing about it is it's not just for infection. This protocol is arguably one of the best foundational protocols you can use for cancer. Okay, because everything that's going on in cancer is what you address with this protocol. Both ozone and vitamin C kill cancer cells. Both of them support detoxification. The vitamin C helps reconstruct tissue and helps support normal immune system function. So all of these things are absolutely everything you want to do with most chronic degenerative diseases, the prototype of which is an advanced state of cancer. Now, this particular itemization of the protocol is nothing that's etched in stone. I mean, once you start working with these things, you can rapidly put in your own modifications depending on the patient and what their needs are and what their response is. I mean, we all always have to be responsive to the patient's response. Okay, just did you get the outcome you're looking for? Are they feeling better? Are they feeling worse? These are very important day-to-day considerations, and you can do day-to-day modifications. But basically, you start out with the lower dose of vitamin C and work your way up. Also at the Reardon Clinic, and it might seem a little redundant, but it's a good thing to do, in addition to the ozone, periodically administered, they also do ultraviolet blood irradiation, which in many ways is doing a similar thing to what the ozone does, but by just a different mechanism. Also, I didn't mention this in the last presentation when we're talking about the variations on IVs, intravenous administrations. Let me say this, never pass up the opportunity to give somebody magnesium. Magnesium is just about the most important nutrient there is. Better than vitamin C. Why do I say better than vitamin C? Because nothing can compensate for a magnesium deficiency other than magnesium. Vitamin C can be partially compensated for by other antioxidants. Okay, so that's the main reason. High doses of magnesium can give you, I mentioned this I think the first day, profound effects for many years on your longevity and decreased all-cause mortality. It still defies my logical explanation as to how something taken in a very high dose over a 24-hour period can still be having a discernible effect on keeping you from dying 5 years later. Certainly there's no amount of vitamin C you can take in a day that would have that effect 5 years later. But when we talked about calcium overload, which recall is what I said is underlying the increased oxidative stress that is characteristic of all chronic degenerative diseases, the single most important thing for lowering those intracellular calcium levels lowering the increased oxidative stress is magnesium. Magnesium is nature's calcium channel blocker. And calcium and magnesium are the yin and the yang. They're never both elevated, they're never both depressed. If calcium is up, magnesium is down. If magnesium is up, you're pushing calcium down. The only problem with magnesium is it has, just like high-dose vitamin C, the bowel effect. So you start taking a lot of vitamin C. What do they do to prepare you for a colonoscopy? Magnesium citrate. Okay, so it's a very good way to evacuate your bowels, no doubt about it, but unfortunately, we rarely get enough magnesium even if we take it to the point of bowel tolerance. So whenever you have the opportunity, you add several grams to whatever vitamin, whatever IV that you're giving, okay? It's the only time that you worry about adding magnesium to his IV is if you plan on giving the IV extremely rapidly, okay? Magnesium is not vitamin C. I mean, you give magnesium really rapidly, you'll make somebody hypotensive, you'll put yourself in a bad situation. But if you're just going to have a regular slow infusion, always add magnesium. And these are the rest of the slides that show the variations. Dr. Honeyhockey even got to the point where he initiated the concept of a built-in mop-up vitamin C protocol within the IV itself. So he'd give the first 2/3 of the IV fast, and even before waiting for having the patient not feel so good, he'd immediately give the last third slow. And so far, that's worked out pretty good as far as keeping the patients feeling well while you have them on a good protocol. Now, the oral aspect, I mean, that was the IV aspect of the ascorbazone protocol. Got the ozone, got the ultraviolet blood aeration, got the intravenous vitamin C. Well, especially when you have control of the patient, because, you know, sometimes they're not so compliant when they go home, but if you're seeing them on a regular basis, or if they're an inpatient and you have control over what they get, regular liposome encapsulated vitamin C and also liposome encapsulated glutathione. The ascorbate powder, for the reasons we talked about keeping the gut toxin free, and the ascorbopalmitate, that's the fat-soluble form of vitamin C. Magnesium, you can use different forms of magnesium. I just have magnesium glycinate up here because that's magnesium associated with an amino acid glycine that you can't really get enough of either, so you're not going to risk overdosing anything by taking large amounts of magnesium glycinate. Vitamin K preparation with K2 is very important. You recall in Death by Calcium, in addition to magnesium, vitamin C, and vitamin D, vitamin K, especially K2, is critical at mobilizing calcium deposits and getting the calcium levels in your body down. And when that happens, everything functions better. Vitamin D3, I didn't discuss this, but I will tell you that it doesn't have to be done frequently, but you have to supplement vitamin D3 and regulate it with your blood levels, okay? These numbers could change since things are always evolving, but right now it appears the best level of magnesium to maintain in your body is between 50 and 80 nanogram per cc, and it's a simple blood test you can do to make sure it gets there. Now, somebody might say, well, man, that's a lot of trouble to go to. I mean, taking a supplement and doing blood levels, forget about it. All I can tell you is two striking facts about vitamin D. If you have too little of it in your body, you die sooner. If you have too much of it in your body, you die sooner. So Your choice. Die sooner with too much or too little, or take the time to adjust the level correctly. It's quite stable. I mean, once you found a dose that you or your patients you're right in at a 60 or a 65, it's not going to fluctuate wildly. You can check once every 6 months, okay? And practically speaking, as a generalization, most people are going to get where they need to go, taking 5,000 to 7,000 units a day. But that's not etched in stone. You got to check it, and you got to make sure. There's nothing more important in terms of preventing cancer than having a normal vitamin D level. Zinc is especially good to supplement if you're dealing with a patient on the ascorbazone protocol with an infection. And obviously, this is a short list. I'm not going to say that these are the only important oral supplements that you can take. You're forever facing a scenario that's going to vary from one patient to the next. And it's going to vary based on what the patient can afford. It's going to vary on what the patient can stomach and not have a chronic stomach upset. I mean, some people could take 40 or 50 supplements with no problem. Others take 3 or 4 and they have a chronic stomach ache. So you need to look. So that's why I start with what I call the foundational supplements. Do try to get these foundational supplements. And let me tell you, there's tons of supplements are great. They got hundreds of them, maybe going on 1,000 that are beneficial. Well, can you take 1,000 supplements a day? No. So it's an open scenario as to what the other things are that you want to put in there. Things that you have experience with, things that the patients can afford, things that don't irritate a sensitive stomach. Now, for all the reasons I talked about earlier, even though it's not necessarily part of the acute protocol, ascorbazone protocol that you would put a patient on to try to resolve an acute infection, a chronic infection, or to get them on the right track toward controlling a chronic disease like cancer or heart disease, you absolutely have to adjust the hormones, okay? If they're frankly low, okay? If you have somebody in the low normal range, you don't necessarily need to go crazy. You don't necessarily need to do anything, okay? But if the testosterone is objectively low in the man, the estrogen is objectively low in the woman, okay? And the thyroid function is out of whack based on the T3 reverse T3 ratio we talked about. You need to address those because those are like the critical factor that's going to determine how well the protocol works, okay? What works well on a cell that has normal testosterone, estrogen, and thyroid levels doesn't work on a cell where those are deranged. As a practical point, and I can't go into a detailed hormone supplementation sidebar here, but as a practical point, you always go low and slow, okay? So the older, you should never not address these issues if a patient is elderly. But you do need to address it more gingerly, okay? You putting a lot of testosterone in an 85-year-old guy, is like putting jet fuel inside a Model T, okay? You're not going to get the result that you want, but it doesn't mean that going extremely slow at an extremely low dose over an extended period of time is not going to give you an improvement in your results. But what do they say the side effects are of testosterone in the elderly? Well, a destabilization, maybe a heart attack, okay? Well, let's go back to our earlier principles. If you have an 85-year-old and the testosterone is just way out, way low, when you start not only on a very low dose, but you also check your baseline CRP and metabolic syndrome-related blood work. And if after 2 or 3 weeks those are better, you're on solid footing. If after 2 or 3 weeks the CRP is going up and those other things are going up, well then maybe you gotta leave that fellow alone or try it even slower and lower. But most of the time it's going to be a positive outcome. But remember, cardiac events don't come out of nowhere. They are always preceded by derangements of the laboratory values. You just don't go from having no heart attack to having a heart attack if your blood work is normal and stayed normal. Just doesn't happen. I mentioned this earlier, but let me re-emphasize it at this point in time. They scared a lot of women out of any sort of supplementation with these studies on progestin with increased breast cancer. If you look at the data, it's very clear-cut. It's just with progestin, which is a synthetic progesterone. It's not with bioidentical progesterone, and it's not with estrogen. Matter of fact, even lousy estrogen doesn't cause it. I mean, they look at Premarin, which is estrogens that comes out of pregnant mare urine, Premarin, pregnant mare urine. That's not the problem. The problem is progestin. But it's incredible how we can do these huge studies at medical institutions and reach clear-cut conclusions, and it still doesn't change the way hormone replacement or anything else is practiced. But you're fine with progesterone and estrogen. You just have to go slow and follow your blood work. Okay. I don't know how readable that is. The essence of it is this. About 5 or 6 years ago, after I gave a presentation in Tennessee, I don't even remember what I talked about. But there were a lot of patients and lay people there as well as doctors, and I always generally talk about, well, if you're not getting the response you want with vitamin C, take more. If you're not getting the response you want with vitamin C, take it more often. Don't give up, blah, blah, blah. Well, I got an email from the nurse at that institution a few months later, and she said, I have an interesting patient I want to tell you about. I said, okay, sounds interesting. I said, well, this lady had Lyme, and she had all the abnormal blood tests. She was already taking a lot of liposomal nutrients, and she decided she wanted to take high-dose intravenous vitamin C. I said, oh, okay, sounds interesting. What happened? She said, well, she decided she wanted to take 100 grams a day. I said, okay, what happened? I said, well, we started on 100 grams a day, and I think it was a weekend institution, so maybe she didn't get it on Saturday or Sunday, but she got it at least 5 days a week. So she got 100 grams of vitamin C every day, 5 days a week, and here's the kicker. After she got her 20th IV, she didn't feel better at all. She had zero improvement. Now, as physicians, we feel bad, not only bad about patients not getting better, but we feel really bad about draining their pocketbook. But this lady was motivated. And I don't know what she was motivated by unless she just listened to what I said, but she continued. And the nurse sort of, with the doctor, reluctantly, they explained to her, and they said, well, you know, if you're paying for it, we'll go ahead and do it. It's not going to hurt you. And so she did 3 more infusions. On the 23rd infusion, She came in the next day, and the nurse reported it's like a light switch went on. She went from no improvement clinically to feeling perfectly normal after the 23rd infusion. And quite intelligently, again, maybe it was something that I said, she realized and wanted to avoid a relapse, so she insisted on getting 5 more infusions just to make sure everything stayed down. She took 5 more infusions, repeated all her blood testing a month later. Everything was normal, no abnormal Lyme. And boy, did that throw me for a loop. What was interesting, though, is I told a few of my colleagues about this, and so I told one colleague that treated a very high volume of Lyme patients like this. And like then 6 months later, he writes me back an email and says, this is going to sound crazy, he said, but I have had the identical experience with 15 more patients that your nurse had with that one patient. They all showed no improvement for 20 or so infusions. Then they did fantastic, and they've had no recurrence. Now, how do you put all this together? I mean, Lyme is a very peculiar, infection. Let me just say, these are some of the things that might play in that particular scenario. First of all, when Lyme disease has been long-standing, there's a serious derangement of the redox ratio inside the body. So 1 or 2 or 3 IVs of a high-dose antioxidant is not going to normalize the ratio of reduced to oxidized biomolecules. So there's a cumulative effect in a very long, I mean, I'm sure all of you know that, you know, you get some of these chronic Lyme patients and they have no vitality left. I mean, they have just been knocked down to 0. Well, you don't go from 0 to 100 overnight. The other thing is the Lyme infection itself continues to produce pro-inflammatory lipoproteins. And some interesting facts about the Lyme microorganism. It's called Borrelia burgdorferi. Some of the names they come out with. And you might note these different references if you want to get more information on it, but the Lyme pathogen has been documented to hide intracellularly in macrophages, inside heart cells, and even wrapped around collagen fibers. It can form cyst-like forms that are much more resistant, and it's especially effective in forming especially tenacious and resistant biofilms. And when you do that, it's like these pathogens just get an extra wall of armor. I mean, it doesn't mean if you're able to put them inside a test tube, you couldn't knock them out, no problem at all. But once they're encased in these biofilms, it's not so easy to take them out. Now, I mentioned this earlier, but I'll mention it again right now because it fits into the uniqueness of Lyme being so tough to deal with, is that Lyme, as far as my research tells me, is the only pathogen that does not require iron to sustain itself, okay? Instead, it thrives on manganese, okay? Now, I think the Fenton reaction can be upgraded inside the Lyme pathogen so that you could eventually kill the Lyme pathogen like you can kill any other pathogen by the Fenton reaction with iron, because this all involves electron shift. I just don't think it's as easy to do. And I don't think the electron relay goes as easily. So even though manganese, like iron, can exist in 2+ and 3+ forms, the 3+ form is unstable and quickly reverts to 2+. So all of this translates into the fact that the Lyme pathogen is not as susceptible to upregulation of the Fenton reaction as these other pathogens. I mean, there's got to be something underlying it because it's just stonewalls so many attempts toward resolution. And interestingly enough, the three most common antibiotics used for Lyme, doxycycline, tetracycline, and erythromycin, on regular infections, they're very effective because they're also iron chelators. But if you chelate iron for the Lyme pathogen, it doesn't make any difference because it doesn't thrive on iron. Okay, biofilm. You also have a problem that complicates Lyme where you're dealing with chronic Lyme, or what's called the post-Lyme disease syndrome. And this, again, is one of the main differences between ozone and vitamin C, is even if you destroy the pathogen, you have to have an extended period of quality nutrient antioxidant treatment in order to help gradually undo and reverse the tissue damage that was done by oftentimes many years of this infection. So laboratory testing, I won't go into that. Now let's look at this one patient, and this was a dramatic patient, had chronic Lyme, had it for roughly 10 years, and was one of the first patients at the Reardon Clinic that we put through on this ascorbazone protocol. So let me just read for you. This patient had been diagnosed with chronic neurological Lyme disease and had already been to more than 10 doctors in 5 states over a 4-year period. She acknowledged that some of her treatments had worked for a while, but that relapse always occurred. In her words, she experienced regular seizures, chronic and unbearable pain, electrical shock sensations to her brain, severe anxiety and panic attacks, memory issues, depressed ability in terms to think, nerve damage, insomnia, fatigue. Sorry, she covered all the bases. And even more succinctly, she just said it was a monumental struggle to endure. Now, interestingly enough, she had been through so much and so many symptoms and so many temporary responses and then relapses. Her main concern about trying this therapy was that it would be effective, and then she'd relapse again. So it just damaged her outlook on life as well. Okay. I'm not going to say her response is typical, but it was dramatic. Using the ascorbazone therapy protocol, she, first of all, experienced no detox or Herxheimer-like reactions. So she didn't get sick from the therapy because it was causing too much pro-oxidant debris in the blood. In only 6 days, she went from, usually the protocol goes on for about 2 weeks at the clinic. In only 6 days, she went from sitting in a chair for 4 straight months to literally moving all day without sitting. She absolutely had a complete recovery and in very short order. Again, I don't want to represent that as a typical result, but I do want to represent it as a result of what can happen when you use certainly what I consider the 2 most effective interventions available today, which is vitamin C and ozone. Those 2 things together can have a synergy unlike anything you've ever seen, And again, no promises that it's going to work on your toughest patients, but I do promise you that a percentage of those toughest patients that never responded to anything else will. I mentioned earlier the importance of not making the patient sicker in the process. And remember, Dr. Honeyhackey had already put into the protocol a built-in mop-up phase. So he had already had an automatic point where the IV slowed down so that there was a mop-up phase, and this could have certainly played a role in her not having any downtime. Okay. Now, in dealing with chronic infections, I mean, I'm not going to tell you, and it's not true, I mean, something like the ascorbazone protocol is not going to resolve a chronically infected tooth. However, you can stabilize this thing, and there, in addition to, just like I talked about the tonsils, they now have a lot of applications where they will inject ozone directly in and around the infected apex of these teeth. That, if you combine it with proper hormone adjustment, and you see your CAP go from abnormal down to solidly normal, you have a good reassurance that you have that patient back on a stable track. So, I mean, for a long time, it was just, you know, if a tooth is infected, extract it. And that is the safest thing to do, but not everybody wants their teeth extracted. So what do you have to offer them that may give them stability short of having teeth extracted? Now, with vaccinations, another form of toxicity. Some people are either reluctant to express their opinion or they don't have a certain opinion on something, but I can tell you, in my medical opinion, there is never an indication for a vaccine for anyone at any age for any reason. If the pharmaceuticals gave enough of a damn to actually produce a vaccine from legitimate infectious agents without added mercury, without added aluminum, I mean, they actually have something called the multi-use vial and the single-use vial. The single-use vial has no preservatives, and a lot of people do fine on that. But that's not economical. You know, use the multi-use vial and have a lot of preservatives in it. So the only thing that I say is there might be potential in the future, not now, where limited, well-produced vaccines could induce the antibody reaction you're looking for with no significant toxicity at all. Okay, there is no reason that any babies should be ruined for life to any percentage degree just because you might be preventing an infectious disease that would be readily cured by vitamin C. There's nothing that a vaccine is purported to do that can't be done by vitamin C. So having said that, I don't recommend vaccinations, but some people, and I sympathize with the pressure. I mean, to me, if I were a younger person, one of my greatest deterrents to having a child would be already anticipating fighting the government over vaccines, because what's the option? You want to give in and let your child be brain damaged, how you feel about that, or you want to spend a life as a fugitive. It's not much of an option. But let me tell you one thing about vaccines. About 20 years ago, I wrote an article. I like the title. The title is Vaccination, the Shot That Keeps on Shooting. And even back then, I was pretty compulsive about how well I do my research before I write something. I don't like to, when I just give an opinion, I like to make it clear it's opinion, and otherwise, I got it from the literature. Well, they had an article in the Journal of Pediatrics, of all places, that showed that the pertussis arm of the DPT vaccination was used by animal researchers to deliberately induce encephalitis. Now, animal researchers don't want to work with animals to produce a condition that they can't produce 100% of the time in order that they can do their experiment with whatever they were studying in encephalitis. But the point is every baby, every child gets encephalitis. The only question is, how well does the nutrient status of the body reverse it and fight it back off again? But this vaccination is a perversion. Pediatricians should call themselves vaccinologists. They don't deserve to be called pediatricians. Okay? Now, with all those wonderful words about vaccination said, if you have a baby or a child and you don't want to go to jail, and you want to have a pretty strong assurance that your baby or infant's not going to be damaged, you give large amounts of vitamin C before, during, and after the vaccination. What's the ultimate antitoxin on the planet? Vitamin C. So take advantage of it, use it, okay? Not only that, if you do have a vaccine that has a minimal use, the vitamin C actually increases the antibiotic reaction. So you actually not only suppress the toxicity, but you manage to multiply what little positive effect that vaccination would have had. Okay. Now, we've had some very interesting recent current events. This article is out of 2016, and it showed that vitamin C, not surprisingly, because of its high effectiveness against bacterial and viral infections, is also effective against sepsis. Sepsis, of course, is an advanced infection, usually disseminating through the body, so you have positive blood cultures, and oftentimes progressing to the point where you're going into shock, you're losing your blood pressure. Before I go into that, I'll just show you a quick series of slides. Ebola is very easily curable. Okay, so don't believe all the garbage you read. Vitamin C in combination with ozone has done it very nicely, and not that large a dose. Okay? Some viruses have horrible clinical syndromes, but the virus itself are wimps when it comes to ozone and vitamin C. And there's actually an article there where you can see that. Zika, same thing. Whether or not you believe about whether or not it causes microcephaly, it also is very easily cured by C, ozone, and even intravenous hydrogen peroxide. Chikungunya, another exotic virus, which I've had some personal experience with because I've had family members from Colombia, South America, get chikungunya, and let me tell you, you wish you had died when you had chikungunya. It's one of the most vicious viruses I've ever seen. It gives you very rapidly a debilitating arthritis where you don't want to move a joint in your body. You don't want to get up out of bed to go to the bathroom. And this can go on for months to years. Now, in the case of my wife, actually, and a friend of hers came back from Colombia, had chikungunya. My wife's young enough, she had overcome much of it, but she still had a debilitating arthritis in her young hands. I started some intravenous ozone, and before I was finishing administering it, the arthritis had disappeared. I mean, the profound ability of ozone and vitamin C to deal with just about any infection, especially viral, is unbelievable. So, now, vitamin C and sepsis. This is another study. About a month and a half to 2 months ago, and I'm going to snowball this into some legal considerations, I wrote an article that called Vitamin C and Sepsis, the Genie is Now Out of the Bottle. What did I mean by that? Well, we've known for many years, just as you've seen over these last 2 days, that vitamin C has been documented to do all these incredible things, so at least in this room, that's not a secret. To the rest of the world, it is a secret. Now, how do you get secrets out? You don't get them by publishing in the literature. The best way to bury something forever is to publish it in the literature. You get something out by two mechanisms. One is by writing a book or putting an article on the internet, okay? Or something that almost never happens, you whet the appetite of the mainstream press and you get on local television. You get on local television, game's over. Because regular people watch television. And when regular people see other people's family members recovering from something that would have put them under in 24 hours, they're going to be a little bit more resistant. Dr. Marek in Virginia, a couple months ago, and he published this, he published that about a year ago, he had an advanced sepsis patient going into shock, and he was going home for the night. He had actually read a little bit about Klenner, looked online, kind of knew that vitamin C might do something, and so he ordered 1.5 grams of vitamin C every 6 hours, that's 6 grams a day, and a couple hundred milligrams of hydrocortisone, and some thiamine. I don't know if the thiamine played any role or not, but got thiamine too. And then he went home that night, and in his words, he asserted that I was expecting the next morning, when I came to work, she would be dead. He then added, but when I walked in the next morning, I got the shock of my life, as the patient was strikingly improved and subsequently proceeded to a complete recovery. Well, once he saw this, he repeated it on 47 more consecutive septic shock patients in the intensive care unit, and then published a paper comparing the results to an earlier 47 patients that hadn't received the protocol. Well, the patients who didn't receive the protocol, 40% of them died. The ones that received the vitamin C hydrocortisone protocol, 1% died. Now, if anything other than vitamin C did that, it would be labeled a miracle drug. Okay? So, the point I would then make, and this all came up since I had the slide, so I don't have a slide to put this on for you, but let me just read for you the last couple paragraphs. I wrote this article, we got it out online, done a few radio shows, but let me say that, and remember we talked about taking vitamin C levels, and I'm going to talk about that in a moment. That's something you can do right away, but Dr. Marek also made the point that critically ill patients have either very low or undetectable vitamin C levels in the blood. This alone would always justify the administration of vitamin C. A scientifically sound argument can be made for the septic patient ultimately dying just because of this profound lack of vitamin C remaining in the body. Also of note, Dr. Marek used a vitamin C dosage of 1.5 grams every 6 hours or until discharge. Much larger doses of C could be used, but the point is they worked out together. He also measured oxalate levels, and even though he found that oxalate levels stayed in the safe range, he pointed out that in patients with renal impairment, these are his words, every single patient who received the protocol had an improvement in renal function. So just come around full circle to this not only lack of toxicity of vitamin C, but actually its ability to improve the function of the organ that it's accused of damaging. Now, legally speaking, the genie is now out of the bottle. With the publicity given to Dr. Marek's protocol, especially on television and videos on the internet, and you can go to my website, and this is the most recent article that's been published on the website, and see these videos as well. Treating physicians are no longer in a position to deny any patient the benefits of such a therapy, or even to say they have not heard of it. Physicians have an obligation of due diligence in educating themselves on the most current of treatment recommendations for a given condition. You know, you may have heard the expression, ignorance of the law is no excuse. This is especially true when the treatment is inexpensive, non-toxic, and effective. When a treatment is very expensive, significantly toxic, or questionably effective, a legitimate medical legal argument can be made to withhold such a treatment. None of these considerations apply to Dr. Marek's cocktail of vitamin C, hydrocortisone, and thiamine. Now, of course, they all say, well, more studies are needed. We've seen that a lot, okay? Well, even if subsequent studies show less dramatic results than those achieved by Dr. Marek in terms of his treatment of septic shock, there is no defense a physician can offer other than arrogance and pride at being told what to do to withhold this treatment from a patient dying on the ICU and not responding to traditional antibiotics and supportive therapy. And let me say this, just to bring this other point home. The most common cause of death in hospitalized patients is sepsis. So we're talking about many millions of lives a year around the world. So to be perfectly clear, there could never be an argument that the protocol is supplanting or replacing other indicated treatments. So now, bottom line, if you have a family member dying of sepsis on an intensive care unit, demand that Dr. Marek's protocol be immediately instituted. And if you are denied this option, don't be a withering flower. Make sure your patient understands completely that immediate legal action will be taken to initiate the therapy, and that the death of your loved one will assure the initiation of a malpractice suit against that doctor. Don't play around. Also, a smaller point, but very important when it comes to legal intimidation, especially of wimps like doctors. However, only sue the physician in charge. Don't be suing the hospital, don't be suing anybody else, don't be suing the staff or the nurses. Sue just the physician in charge, as physicians have a herd mentality and are scared to death of being the sole focus of a medical medical legal challenge or a malpractice suit. Now, the genie's out of the bottle. All we need, I gotta figure, we've already had a bunch of patients and doctors that have written me. This is gaining a little bit of a life of its own, and it should. Because when they say we want more studies, you want more studies when you have a therapy of questionable value, a therapy that has a balance of toxicity versus benefit. But when you have a therapy of no established toxicity, even if you question its benefit, it's irrelevant because it's cheap and non-toxic and the patient is going to die in 24 hours. There is no defense. And if you have a family member in the ICU and you want to be a wimp about it, fine. But you have the information on your side, and you should take the gloves off and directly threaten that wonderful doctor with a malpractice suit, promise a malpractice suit if they won't start the therapy and your loved one dies. Okay, I'll give you a quick recap, and then we can take any questions. Oh, the one more thing, I said this before, but this is especially important in this context. On all your critically ill patients, do plasma vitamin C levels every day. And if they're low, give them vitamin C. It doesn't have to be oral. It doesn't have to be intravenous. It can be oral. Give them vitamin C every day that their plasma vitamin C level is low, and do not put in the progress notes that it's going to have anything to do with helping the infection, helping resolve anything, that all you're doing is trying to restore a blood test that documented a deficiency of vitamin C back to normal. Okay? So, recap. Many chronic degenerative diseases, likely most, have significant underlying infectious components. Number 2, all chronic diseases and infections are accompanied by subclinical, sometimes overt, scurvy, unless vigorous supplementation is being taken. Number 3, both vitamin C and ozone are excellent standalone therapies for all infections and nearly all chronic degenerative diseases. Even though ozone knocks out infections, it's incredible how ozone as a standalone therapy has done miracles for many cases of advanced cancer. Number 4, ascorbazone is a therapy that achieves positive synergistic effects beyond just the added benefits of vitamin C and ozone. Number 5, when a treatment protocol, whatever it is that you're using, is not achieving what you consider to be the target therapeutic goal, consider using an ascorbazone protocol. Number 5, vigorous vitamin C has never been proven to fail in curing an acute viral syndrome. And number 7, sort of reiterating what I just said, and actually this is even more true now, patient members can now demand IV vitamin C for their family members in the ICU. Don't hesitate to directly threaten malpractice, and even if your heart is broken after your loved one dies, don't fail to follow up and sue. Okay? It's monumentally sad that we even have to think of mental manipulations like this to give patients honest medical care. But we have to accept the situation for what it is. Okay, we can't change things. And remember this too. everything, especially in medicine, proceeds in a positive direction by micro-incrementalism. You just take a tiny nip a day, next thing you know, some progress has been made. But physicians don't change overnight. They mainly change by dying and having new ones come in that don't have the same biases as the old ones. So, thank you.